Welcome doctors to my lecture. We are studying neuroanatomy. Today, we will discuss an important topic, that is cranial nerve injuries and their associated deviations. These are very important for the localization of stroke. Don't forget to support by subscribing and liking my channel. Thank you. Vagus nerve is 10th cranial nerve. It supplies the muscles of soft palate. When it is injured, uvula deviates away from the side of lesion due to pull by healthy muscles. In this picture, you can see the deviation of uvula to left in right vagus nerve injury. Injury and deviation are opposite. Hypoglossal nerve is the 12th cranial nerve. It has motor supply to the muscles of tongue. When it is injured, tongue deviates towards the side of lesion due to atrophy of intrinsic muscles on side of injury. In this picture, you can see the deviation of tongue towards right side due to the right hypoglossal nerve injury. The trigeminal nerve is the 5th cranial nerve. It supplies muscles of mastication. In this picture, you can see the deviation of the mandible or jaw on the right side. In trigeminal nerve paralysis, the jaw deviates towards the side of the lesion due to atrophy of masseter muscles on the affected side. Facial nerve is 7th cranial nerve. It has motor supply to muscles of facial expression. If facial nerve is injured, the angle of mouth deviates away from the side of lesion due to pull by healthy muscles. In this picture, you can see angle of mouth deviated to right due to left nerve injury. This is the crisp and easy to remember summary of the lecture. Prepare yourselves for brainstorming. Let's have a rapid quiz. Question 1. Please read the question and the options carefully. Please see that there is a right hypoglossal nerve injury. Tongue deviates towards the side of nerve lesion, so option A is correct. Question 2. Please see the question and the options carefully. The basic concept is that uvula deviates away from the side of lesion. So, the correct option is B, left vagus. Respected doctors, question 3. It's time to test your knowledge. Please read the question and all the options carefully. The catchphrases are right-sided weakness and mandible deviated to left. It means that there is lesion of left trigeminal nerve because the jaw deviates towards the side of the lesion. As weakness and cranial nerve involvement is on the opposite side, so it is crossed hemiplegia, which occurs in lesion of pons. So the correct option is A. Here comes the tricky one. Question 4. Please read the question and the options carefully. The catch points are deviation of tongue towards right and decreased sense of touch and vibration. This is medial medullary syndrome caused by occlusion of anterior spinal artery, so option C is correct. Please read the question and the options carefully. It is tricky. The catchphrases are right-sided weakness and angle of mouth deviated to left, showing right facial nerve lesion, because mouth deviates away from the side of lesion. As weakness and cranial nerve involvement are on same side, so it is uncrossed hemiplegia. It occurs in lesion of internal capsule. So correct option is B.